prostatectomy is a surgical procedure to remove all or part of the prostate gland in a male with an inability to completely drain the bladder, bladder stones causing prostate enlargement, prostate cancer, prostatitis, or benign prostatic hyperplasia. The prostate is a walnut-looking and sized gland between the bladder and the penis. It rests directly in front of the rectum, hence why rectal exams also include prostate examinations. The prostate has the urethra running through the middle to excrete all urine out of the body. It also secretes a seminal fluid to nourish and protect the sperm during ejaculation. To examine the prostate and diagnose any conditions, there are a few tests that can be done. A digital rectal exam, or DRE, is done by simply inserting a finger into the rectum and feeling for an enlarged prostate gland anterior to the rectum. A prostate-specific antigen, or PSA, is done by taking a blood test to test the prostatic antigens. If these antigens are high, there is a high likelihood for prostatic cancer, but an enlarged prostate can also cause these numbers to rise. Lastly, a prostate ultrasound and biopsy are typically done together. This is to show the prostate and to take a piece of tissue to be tested. This surgery can be performed as a TURP, open suprapubic, laparoscopic, retropubic, or perineal prostatectomy. I'll be going over in detail the suprapubic approach. General anesthesia will be administered and the patient will be intubated in the supine position. To maximize visualization, during the case, a pad may be placed underneath the buttocks. Directly after this, the patient will be prepped starting at the suprapubic incision site, extending up to the nipples and down to their lower thighs, reaching the table on both sides of the patient. To drape this patient, a towel and sheet drape will be placed underneath the scrotum. 4 folded towels will be placed around the incision site, and a laparotomy or transverse sheet will be placed on top. This procedure may need an ESU, suction, a bare warming unit, major tray, long instrument tray for larger patients, a prostatectomy instrument tray, prostatic lobe forceps, hemoclip applier, and possibly a Judd Mason abdominal retractor. Lidocaine may be injected by surgeon preference. A transverse incision is made at the suprapubic region, then tissue is dissected until the bladder is visualized. Another incision is made into the bladder at the prostatic capsule. The prostate is located and dissected away from its capsule, then removed from the body. The bladder is then assessed for any other defects, pathology, or more. Hemostasis is achieved and a Foley catheter is placed into the urethra. Another suprapubic catheter is placed and exits through another small incision site in the skin. The bladder incision is closed first, then working their way out until the skin is closed. This incision site will be covered with steri-strips, gauze, and an outer sticky layer like tegaderm. The prostate is a specimen and the surgery is classified as clean contaminated.